Good morning, everyone, and welcome to Mile High Living. I'm Gina Bellich. In 2009, the first family-owned and operated American Vein and Vascular Clinic opened in Pueblo, and now they are Colorado's largest network of vein clinics. Their vein specialists perform the latest therapies to remedy vein disease, and today founder Dr. Gordon Gibbs is here to talk with us. Thanks so much for being here.
My pleasure, thank you.
Let's really talk about, this is a family-owned practice, right? Let's talk about all the services you provide.
Sure. Yeah, so American Vein and Vascular, we've been around now for 14 years or so. We are the largest network of medical practices specifically devoted to treating vein problems in people's legs. So yeah, we're family owned and operated, which means we're independent of any hospital organization or system, which I think affords us some flexibility in terms of designing patients' care and designing their experience. Because this is all we do, the whole experience for a patient is designed around how it is that we can best take care of their veins specifically.
Now, when we talk about family owned and operated, it's something you pride yourself on, but what does that really mean to your patients?
Yeah, I think it gives us that independence, gives us the flexibility and freedom to kind of make decisions that are specifically in the best interest of our patients. And because all we do is vein care, that's what it's all about, is making sure that their experience with regards to their vein care is the best that it can possibly be.
And congratulations are in order, because I understand you have a new clinic opening up,
We
and
do,
actually two of them, correct?
Two, yes, indeed. Yes, thank you. Appreciate it. Yeah, so venous disease is very common, and so there's a lot of people out there with this. Probably a third of adults will have some sort of trouble. And so we're trying to basically create an environment where it's efficient and convenient for patients. So we have 10 locations around the Front Range, including the Vail Valley, and so hopefully that's a location that's convenient for most of your viewers. We have a new location in Loveland, which kind of basically right on the junction of I-25 and Highway 34 going out to Greeley. And then we'll have a second location opening in a month or so in Lakewood on the campus of St. Anthony Central.
This is wonderful, because you do have them spread out in so many different locations that you're really up and down the Front Range, correct?
We are, yeah. And really it's designed around trying to be convenient for patients. So sometimes it requires multiple visits to come in. And so from the moment they make the first call to the last treatment that somebody might do, sometimes they'll come in multiple times, and we try and make every step of the way efficient and convenient for them.
When we talk about vein disease and the type of issues that you're treating, can you be a little bit more specific? Because a lot of people at home may be suffering from this, but not realize they need your help.
You bet, happy to. So a normal healthy vein will carry blood from your feet back to your heart. In that normal healthy vein, there are small valves that open and close and basically keep the blood flowing in the correct direction. When those valves become diseased or leaky, gravity will pull the blood in the wrong direction in those veins, which puts the veins under higher pressure and causes blood to pool down by your feet and ankles. And that can cause a variety of symptoms. It can cause pain, it can cause heaviness, it can cause discomfort, it can cause swelling. Generally, it's more so towards the end of the day than first thing in the morning. Sometimes people have nighttime symptoms with cramping or restlessness. And all of these things can really become an influence to their quality of life. It's certainly not life-threatening, but it can make a big deal in terms of the way people feel.
And if I remember correctly, having talked to you before, the causes of this, a lot of times, it's just genetics. Is that right? We get to blame mom and dad for this?
Gotta blame mom and dad, you bet, yeah. But it's also influenced by your lifestyle. So, for example, if a woman has multiple pregnancies, that can put them at higher risk. If they're heavy or have a kind of more of a sedate lifestyle where they're sedentary, that can put them at slightly higher risk. If they have an occupation where they're on their feet all the time, certainly by the end of the day, their legs will hurt more than if they've been kicking them up in a hammock all day long.
So if our viewers are out there watching right now, they're looking at the pictures, they're like, well, maybe my legs look a little bit like this. Are there some common symptoms they should be aware of?
Yeah, I think probably the most common thing is going to be heaviness, discomfort, and aching towards the end of the day. The kind of discomfort that is relieved if you kick your legs up on the back of the couch or something like that, or prop them up against the end of the wall. If you try and go to sleep at night and you have cramping or restlessness, typically within the first couple hours of going to sleep, almost always that's going to be your veins.
All right. That's something to be thinking about, of course, as we think about all these issues, and the help that's obviously readily available as well. Now, something that's also really important to folks is insurance and how to pay for all of this. How do you guys accommodate that?
Yeah, so I suppose that's another advantage of being family owned and operated is we have a dedicated team of people who are specifically involved in knowing what is covered by insurance, what's unique about individuals' policies and things like that, so that we can really cater a patient's care plan around that. Make sure that there are no financial surprises and that sort of thing. But generally, most insurances cover venous disease treatment. Medicare, Medicaid, a lot of the commercial plans cover it. And so knowing what is allowed by the plans really allows us to cater treatment that's going to best benefit the patient and certainly be covered by their insurance.
And boy, do you have the locations to accommodate everyone and make it so simple for everyone as
Thank
well. Dr. Gibbs, we love having you here. And again, congratulations on your new clinics. We
really
appreciate it. Absolutely. So go ahead, guys. Go ahead and love your legs again. American Vein and Vascular Institute offers minimally invasive in-office treatment options for venous disease. Go ahead and call their number today at 8445-MY-LEGS. That's 844-569-5347, or visit them at AmericanVein.com for more information. They paid for today's segment. Stay with us.